Assalamualaikum. My name is Nur Shafinas binti Hassan, and in this video, I'm going to present about um, the COVID-19 effect on healthcare industry. For the summary, COVID-19 affecting many industries in Malaysia, and one of them is healthcare industry. As we know, Malaysia consists of many industries, and one of the main is healthcare industry. Healthcare sector or healthcare industry is a backbone of the country in terms of dealing with health issues. So COVID-19 pandemic has been affecting Malaysia industries, and one of them is healthcare industry. One of the problems that occurred due to COVID-19 pandemic to the healthcare sector is healthcare private sector facing a decline of the patients that causing the fall of revenue in the sector. Due to these problems, telemedicine is one of the steps taken by the government to control the problem faces by the private sectors. Another recommendation that government or healthcare authorities can do is called public-private partnership, where both of these sectors work together to control the spread of the virus. Introduction. On January 2020, coronavirus disease, or known as COVID-19, had reached Malaysia by travelers from China. Due to this incident, leading to massive increased cases among Malaysians, and within a few weeks, Malaysia had recorded the largest number of positive cases of COVID-19 infections in Southeast Asia. And now, Malaysia faces third waves where number of cases more than 10,000. And actually, this pandemic affecting economies quite bad, and it's leading to many failures in businesses. And not only that, many sectors in Malaysia are also heavily affected, and one of them is healthcare sector. For the problems of declining number of patients in private sector, first of all, let us know what is private sector. Private sector is, according to World Health Organization, WHO, private sector is an individual or organization that served or provide health products and services that are not under control or owned by the government. For example, private hospitals, private clinics, and pharmacies. Why the decline number of patients in private sector happened? This happened due to the rapid increase cases of COVID-19, and Prime Minister of Malaysia, Tan Sri Muhyiddin Yassin, announced the first movement control order, which is MCO, from 18th until 31st March 2019. Okay, so this MCO obligate Malaysians to practice social distancing, where they cannot or prohibited to interact with people, and they are suggested to stay at home. Due to this, the demand for treatment of patient, the demand for patients to seek treatment, especially in private sector, will decrease. Not only that they decided to decrease the demand due to the practice of social distancing, but also some of Malaysians believe that the healthcare workplace, like hospitals and clinics, are places that highly risk to the exposure of COVID-19 virus. What happened when the decline of the patients in private sector? Uh, so when there is a decline in private sector, it can cause the rapid fall in revenue. As stated by Dr. Musa Nordin, who is the pediatrician in Anwar Specialist Hospitals, he stated that the hospital faces a 60% revenue fall during MCO. So, as we all know, private sector is built for profit, which means that without profit, they cannot continue their organizations. So when the patient reluctant to seek treatment, private sector cannot gain profit to run their organization. Who affected when there is a decline in the number of patients and rapid fall in revenue? So it will affect the workers of private sector itself. This will force the private sector or the hospitals and the clinics to lay off their workers so that they could cut costs as they are unable to pay the wages, the salary. Um, as for example, as stated by Amrahi Buang, who is the president of Malaysian Pharmaceutical Society, he stated that um, pharmacies are facing a problem whether they want to close the organizations or continue because they had no customer at all due to pandemic. Other than that, it can be convinced more as there are many other suppliers that supply masks, hand sanitizer, and Malaysians can buy them online rather than going to the pharmacies to buy them physically. To solve these problems, there are steps taken made by the government and healthcare authorities and which called telemedicine. Telemedicine is actually a medicine in distance where patients are able to get consultations from healthcare providers through multimedia network. Example, a patient can get consultations through email and video call. Healthcare providers also provide home delivery of medicine to the patient. How telemedicine helped to boost back the revenue? Uh, Due to reluctance of patients seeking treatment in the private clinics or hospital, telemedicine does not require physical interaction, which means that the patient only need to get the consultation through online. That can also help to actually ease the worrisome of some patients who believe that hospitals and clinics are highly risk place for the spread of the virus. Example of telemedicine website is called Doctor on Calls. Doctor on Calls website, which is one of the online platform that provide consultations of health and medicine, stated that they gain more than 5 million visitors and over 3 million monthly users during a pandemic. This is actually show that there's opportunity for healthcare private sectors, doctors and or nurses or staff to use this existed website to gain profit during pandemic. Other than doctor on call, there's also a usage of home GP, which is another online platform that practice telemedicine, and it stated that patients increased by 40 to 50% that seek for their consultation. Example of private hospitals that using telemedicine as their method to consult patients are Sunway Medical Center Velocity and Pantai Hospital, as they know Most patients believe that face-to-face consultations can increase the risk of virus transmission between healthcare workers and patients. For the conclusion, COVID-19 is a global crisis that affected many industries, especially healthcare. Yet, the pandemic actually led the industry to find quick solutions to adapt with the problems. Even though healthcare industry need to face many odds, many challenges, there are also many opportunities that can drive them for better future. Many healthcare authorities and government work hard to find the best solution of COVID-19 pandemic. Um, Due to this, healthcare system in Malaysia can always improve and always increase their quality of services in the future. Other than that, movement control order MCO is actually the best action that government implemented actually to decrease the spread of the virus within Malaysians. As we know, there is still no specific treatment that can cure COVID-19. Although this could actually negatively affect industries, but Malaysians should be responsible to play a big role in order to fulfill the regulations obligated by the government. It will help the country uh, free from the virus, and also it can restore the affected economies in Malaysia. For other recommendation can that the government or the healthcare authorities could do is called the public-private partnership. Um, this method could work where healthcare private sector and healthcare public sector work together uh, in outsourcing the required facilities during pandemic. As we know, public hospitals has been packed with COVID-19 patients, while private hospital facing a decline in number of patients. Due to this, patients of M40 and T20 that seek treatment in public hospital can relocate to private hospital instead. These actually can help private hospital to boost back their fall in revenue uh, due to the decline number of patients. That's all. Thank you very much.